I want to start with a moment I think a lot of us have felt, or at least dreaded. You're sitting with your doctor, or maybe just scrolling through lab results on your phone.
Mm-hmm.
And there's that split second where the air just gets heavy. You see a word like prediabetes or a
Yeah.
note about your blood sugar being a little high.
It's that feeling of suspension, isn't it?
Yeah.
Everything just stops.
Yes. And the first instinct for so many people isn't, okay, what's the plan? It's
Yeah.
it's I don't want to know this. You just want to close the app and pretend you never saw it.
Because it feels like a personal failure.
Yeah,
Or worse, it feels like this sudden, irreversible sign that you're getting old.
exactly. And that is the exact psychological wall that our source material for today, a guide called Diabetes, really tries to break down. It tackles that anxiety from the get-go.
That fear that your own body is turning against you can be paralyzing.
So that's our mission for this deep dive. We're taking that guide, along with a ton of research, and we are stripping away the jargon and the panic. We're
Yeah.
not here to tell you to just eat more kale.
Right. The goal is to help you move from feeling like the patient to, well, to being the mechanic.
I like that, the mechanic.
To understand the engine well enough that a warning light on the dashboard doesn't send you into a panic. It just tells you which part needs a tune-up.
Okay, before we get under the hood, we have to talk about the scale of this, because if you're worried about your blood sugar, you are definitely not alone.
Oh, it's not even a small club anymore.
Right.
It's a global phenomenon. The numbers are just staggering. The guide points out that roughly 1 in 10 adults worldwide has diabetes.
1 in 10. So on a city bus, you're looking at 3, 4 people around you dealing with this.
Exactly. And here's the really scary part of that number. A huge percentage of them don't even know it.
You have no idea.
None. They're going to work, living their lives, maybe feeling a little more tired than usual, but they think they're fine. All while high blood sugar is, silently causing damage.
That brings us to what the guide calls the twist. We all have this stereotype of what diabetes looks like. You picture an older, sedentary person.
The old person's disease.
Right. And that's just not the reality anymore.
It's completely outdated. The data is clear. The age of diagnosis is getting younger and younger. We're seeing it in people in their 30s and 40s.
So people who don't fit that mold at all, but, and this is so important, the guide's main message is that even though this is serious, you are not powerless. This is not your destiny.
It's a management issue, not a destiny issue.
Okay, let's get into the management then. To manage it, we have to understand what's actually broken. What's going on inside the body with type 2 diabetes?
So the basics are pretty simple. You eat, your body breaks the food down into glucose, which is just sugar. That's your body's main fuel.
And that fuel goes into your bloodstream to get to your cells.
Exactly. Your muscles, your brain, they all run on it. But there's a problem. The cells are locked. The glucose can't just wander in.
It needs a key.
It needs a key. And that key is a hormone called insulin. Your pancreas makes it. So in a healthy system, insulin shows up, unlocks the cell door, glucose rushes in for energy, and your blood sugar goes back down.
Simple. So with type 2, does the pancreas just stop making the keys?
That's more like type 1. With type 2, especially at the beginning, your pancreas is actually working overtime. You've got plenty of keys. The problem isn't the key, it's the lock.
The cell itself isn't responding.
Right. Think of your cell less like an empty room and more like a completely overstuffed suitcase.
Okay.
It is packed to the brim with energy it already has, often in the form of fat. So you try to shove one more molecule of glucose in there.
It's not going in. The zipper won't close.
It just won't fit. And that is what insulin resistance really is. The cell is saying, no vacancy. So the insulin knocks, but the door stays shut.
So the sugar is trapped in the blood.
It's trapped. And you end up with this bizarre situation where your blood is full of sugar, but your cells are starving for energy because they can't access it.
Wow. That packed suitcase analogy is powerful. And that's what the guide calls the silent mechanism, because this can go on for a long, long time before you feel anything.
For years, this is the silent phase. Your body is amazing at compensating. When the sugar backs up, your pancreas just says, oh, I guess I didn't send enough insulin, and it pumps out even more.
It's just trying harder and harder.
It's forcing the issue. But eventually it just gets tired. It burns out.
And that's when the blood sugar levels really start to climb and stay high.
Right. And all that time, that excess sugar floating around is like, well, it's like acid rain on your internal infrastructure.
When we hear about damage, what's the sugar actually doing?
Think about where your blood goes.
Yeah.
I mean, everywhere. The sugar molecules stick to proteins, especially in your blood vessels, and make them stiff and brittle.
They clog things up.
They clog up the tiniest pipes. The microplumbing, you could call it.
And where is that microplumbing the most delicate?
Your eyes, your kidneys, and the nerves, especially in your feet and hands. That's why diabetes can lead to blindness, kidney failure, neuropathy. It's literally rusting your pipes from the inside.
That's a sobering image. But it does explain the symptoms when they finally show up. The guide has a checklist, and man, a lot of these are things you could easily explain away.
Oh, we are masters of that. I'm just tired. It's just hot out. I'm stressed from work.
Okay, let's run through them. Excessive thirst and frequent urination. Why do those two go hand in hand?
It's basic plumbing. Your blood is too concentrated with sugar. Your body gets desperate to dilute it, so it pulls water out of your tissues, which makes you feel constantly dehydrated, thirsty.
And then the kidneys have to deal with all that extra fluid.
Right. The kidneys try to filter out the excess sugar, and they dump it into your urine. But the sugar pulls water along with it.
So you're drinking constantly, but it's just flowing right through you.
You're running a tap into a sink with no plug.
What about the fatigue? Everyone is tired these days. How is this different?
It's a different kind of tired. Remember, the fuel can't get into your cells. So even though you have high blood sugar, you are literally starving at a cellular level. It's a bone-deep exhaustion.
And it hits you after you eat, right?
Yes, that's a huge clue. You eat a meal, and instead of feeling energized, you feel like you need a nap immediately.
The food coma, but way more intense.
That's a great way to put it.
A couple of others here. Blurry vision, wounds that don't heal.
The vision thing is interesting. At first, it's often not permanent damage. The high sugar can actually cause the lens of your eye to swell from all the fluid shifts.
So your prescription could change suddenly.
Exactly. If your glasses suddenly stop working, don't just assume you need a new pair. It's a sign to check your sugar.
So if someone listening is ticking off a few of these boxes, that anxiety is probably coming right back.
And this is where we pivot. The guide is so clear about this. If these symptoms sound familiar, number one, do not panic. Panic just makes things worse. But number two, you cannot ignore them.
Because there's good news here. This isn't a one-way street.
Not at all. Especially with type 2, this trend is often reversible. The word we use is remission.
I want to focus on that word, remission, not cure.
A very important distinction. A cure would mean it's gone forever, and you can go back to your old ways. Remission means you've restored your body's function, but you have to maintain the lifestyle that got you there.
Okay, so how do we get there? The guide lays out 3 core changes, and what I like is that they're not extreme.
No, it's very anti-gimmick. It's not about magic pills or weird detoxes, and this is critical. It's not about stopping your medication on your own.
Right, this works with your doctor, not against them.
These changes are designed to work alongside medical treatment to make that treatment more effective or maybe eventually unnecessary.
Okay, pillar number 1, rethinking carbs. This is where people's eyes usually glaze over. They think we're about to ban everything good.
Right, the joy is over. But it's not about eliminating carbs, it's about the quality of the carbs. The main target is what we call refined carbohydrates.
So white bread, white rice, pasta, sugary drinks, the usual suspects. Why are they so much worse than, say, a sweet potato?
It's all about speed. A piece of white bread has had all its fiber, its natural armor stripped away. When you eat it, your body converts it to glucose almost instantly. It's like pouring gasoline on a fire. Whoosh! A massive blood sugar spike.
And if your cell is already that packed suitcase?
That spike has nowhere to go. It just floods the bloodstream.
So the strategy isn't just cutting, it's swapping. The guide talks about what to add.
Yes. Add things like lentils, nuts, vegetables, whole grains. The reason that works is fiber. Fiber acts like a sponge in your gut. It physically slows down how fast the sugar hits your blood.
So it turns that gasoline into a slow-burning log.
Perfect analogy. Instead of a sharp spike, you get a gentle rolling hill. Your body can handle a hill, it can't handle a cliff.
That feels so much more manageable. You're not depriving yourself, you're just being smarter about the chemistry.
That's all it is.
Okay, lifestyle change number 2. I think this one is the single biggest hack in the entire guide, the movement hack.
I love this one. It's so simple, and it takes advantage of a biological loophole. A loophole? Yes. The advice is incredibly specific. Walk for just 10 to 15 minutes after your biggest meal of the day, which for most people is dinner.
Okay, but why after the meal? Why not just walk in the morning?
The timing is everything. Walking after you eat directly targets that post-meal glucose spike.
Yeah.
And here's the loophole. When your muscles are actively working, they can pull glucose out of your blood without needing much insulin.
Wait, really? They can bypass the whole key and lock system?
To a huge degree, yes. It's a separate pathway. So by walking, you are physically creating a demand for that sugar. You're opening up those cell doors with movement. You're helping to empty the suitcase.
That is amazing. You're basically giving your pancreas a helping hand just by going for a stroll.
Precisely. And the guide is clear. This isn't about running a marathon. You don't need to break a sweat. Just move. Consistency beats intensity every single time.
That seems like the highest return investment for your health you could possibly make. 15 minutes. All right, the third pillar. This is the one I think gets overlooked the most. We talk food, we talk movement, we don't talk enough about sleep and stress.
And that's a tragedy, because for some people, this is the entire ballgame. You could have a perfect diet and walk every day, but if you're only sleeping 4 hours and you're chronically stressed, your blood sugar can stay stubbornly high.
How is that even possible? If you're not eating sugar, where is it coming from?
It's coming from your own liver.
The call is coming from inside the house.
It really is. It's all about a hormone called cortisol. When you're stressed, and lack of sleep is a major stressor, your body releases cortisol. Its ancient job was to get you ready to fight a tiger.
Okay.
To fight a tiger, you need a burst of energy. So cortisol signals your liver, hey, dump all our stored sugar into the blood right now.
But there's no tiger, there's just a deadline or a traffic jam.
Exactly. So you get this huge surge of blood sugar, but you're just sitting there. You're not burning it off. And that makes your insulin resistance even worse. It's a vicious cycle.
So what's the actionable advice? Be less stressed isn't exactly helpful.
It's not. But the guide focuses on what you can control. And the biggest lever is sleep, aiming for at least 7 hours. And the number one rule, no screams for at least 30 minutes before bed.
The blue light.
That blue light disrupts your internal clock, which disrupts your cortisol rhythm. It's amazing how many people see their fasting blood sugar numbers improve just by fixing their sleep without changing anything else.
Wow. It really is all connected. The food, the movement, the rest. It's like a three-legged stool.
And if one leg is short, the whole thing is wobbly.
Before we wrap this up, I want to hit the reality check section from the guide. Some really important warnings here.
Yes, this is non-negotiable. We've said it, but we have to say it again. Do not go rogue on your medication.
Talk to your doctor.
Always. If you start making these changes, your blood sugar will come down. If you're still on the same dose of medication, you risk going too low, which is called hypoglycemia.
And that's dangerous in a very immediate way.
A very immediate way. So you have to work with your doctor so they can safely reduce your medication as your health improves. That's the goal. Let them be the one to deprescribe.
Are there any red flags, any symptoms where you should just go straight to an emergency room?
Absolutely. Sudden, unexplained weight loss like losing 15 or 20 pounds without trying, extreme thirst that you can't quench, and a strange fruity smell on your breath, those can be signs of a much more urgent situation, and that's not something to wait on.
Good to know. Okay, let's bring this all together. We've talked about the packed suitcase, the silent damage, and the 3 big levers. Smarter carbs, the post-meal walk, and managing sleep and stress.
It sounds like a lot when you list it, but the guide really emphasizes starting small.
So what's the one thing to do today?
Just walk tonight. That's it. After dinner, put on your shoes and walk for 10 minutes around the block. Just prove to yourself that it's possible.
I love that. The guide also ends on a note about the quiet ones. What does that mean?
It really hit me. It's talking about the people who suspect something is wrong, but are too afraid or too ashamed to ask for help. They're the ones who need this information the most.
So the call to action is not just to help yourself, but maybe to share this with someone who needs to hear it.
Exactly. Sometimes just framing it as a mechanical problem, the packed suitcase, instead of a moral failing, is enough to empower someone to take that first step.
It shifts the story from I'm broken to I just need a little tune-up.
That's it.
You know, it's funny. We're always looking for some huge, complex medical breakthrough. But as I was reading all this, it just struck me how ancient the solution is. Eat real food, move your body, and rest when it's dark.
It's almost like the human body came with an owner's manual,
Oh.
and we've just spent a few decades ignoring it.
Maybe we should stop waiting for a complicated answer when a simple one has been here all along.
I think that's the perfect way to look at it.
Something to think about. Thanks for joining us for this deep dive.
Take care of those engines.